Our next panel will focus on climate smart technologies in the provision of the healthcare services. Your moderator for this panel discussion is our Hey ambassador from Africa, Lawrence. Over to you, Lawrence.
Right, thank you so much, Ashley, and to be here, and greetings across the world. And we would proceed right on with the conversation on climate smart technology and provision of healthcare services. We see that in recent times, climate change being one of the leading crises that we are exposed to, there is a need to also strengthen healthcare systems to be able to have resilient climate change, and to also see it as an opportunity to reduce that impact that is also resulting in healthcare delivery. And we would proceed right away. I would basically introduce our panelists to the call, and I would also like them, when I introduce them, just give about maybe a minute of introduction so that people are aware of the expertise and what they do, how much authority they have to speak to this ground. So first off, with us today as a panelist is Dr. James Hospedales, who happens to be the founder of Medic and Ethnos Foundation for Promotion. Also joining us is Dr. James Hospedales. We also have among the panelists Judith Harvey. Dr. Harvey is actually a civil and environmental engineer, also a technical consultant. We have also as a panelist Susana Benjamin-Reece, who is a Hey Caribbean ambassador at Hey campaign. Then we also have Judith Paige, who is also a Hey Caribbean ambassador for Hey campaign. So very quickly before we just proceeding about say 30 seconds, 1 minute, could you just introduce yourself? I'll start from James Hospedales.
Sure. Hi, everyone. Good day. Thanks and congratulations to the Hey Foundation and Ashley for running this. My name is James Hospedales. I'm a public health doctor of 30 years experience in the Caribbean, Latin America, and I've worked on the disaster response team for the Pan American Health Organization. So I've been to many climate disasters. Currently, I founded and I am the executive director of the Earth Medic and Earth Nurse Foundation for Planetary Health. We aim to mobilize the health professionals of the world to address the climate crisis.
Awesome. Thank you so much, Dr. Hospedales. So can we have a brief similar introduction from Judith Harvey? Good to have you, Mark.
Hello. Greetings to all participants, panelists, and my expertise is as an engineer for 55 across the Caribbean under a project funded by the UK government, implemented by the Pan American Health Organization in 7 countries. So this is real practical experience of creating climate smart health facilities, and that is the basis on which I will speak to you today.
Awesome, thank you so much, Abby. Can we have Susana quickly?
Hello, good morning, good afternoon, good night, everyone. I'm Susana Benjamin-Reece, and I'm from Guyana. I'm a Hey Campaign ambassador and also a third-year environmental health student at the University of Guyana, and I'm thankful to be here today.
All right, so our last panelist, Jonathan.
Hi, good day, everybody. My name is Jonathan Paige. I am a Hey Campaign ambassador. I'm a climate activist, and I'm currently a second-year student at the University of the West Indies in Barbados, studying biochemistry.
All right, thank you so much. And then to our participants, welcome once again. Our panelists have jumped right into the conversation. I said, to give a background, we know how that climate change is fast affecting all sectors. The health sector is not on the left side. So we want to see how that climate smart technology will be very essential in provision of healthcare service. So jump right in. I would start by asking our panelists a couple of questions. I'll direct this first one to, I'll just do it randomly. Susana can take this. How do you think climate smart technology can actually when it comes to improving the accessibility, the affordability of healthcare service, particularly taking note in underprivileged and remote regions? How can climate smart technology help to improve access and affordability? What's your take?
Thank you, Lawrence. So to get right in, climate smart technology, just a little background, is a vital tool for monitoring climate change while promoting sustainable development. And because of such tool, it offers a wide range of solutions which aid in reducing greenhouse gas emission. And just statistically proven, according to the Harvard Hospital report, healthcare sectors are responsible for 4.4 to 4.6% of greenhouse gas emission. And just looking at that number, we can say that that's a lot of greenhouse gas emission. And because of that, climate smart technology helps in two ways. One, reducing the number of medical waste that is generated. And this can be done by switching to electronic documentation so as to reduce solid waste. And two, this is a major one, the implementing of green building designs. So this helps to achieve a more sustainable environment, promote conservation of water and clean energy and environment. And just for a small example, this is done by installation of solar panels to source lighting, water supplies, and even for the backup of machinery functioning. And I just want to take, for example, here in Guyana, as Dr. Judith would have mentioned what she's working on, here in Guyana, we would have recently established the Akppterai Smart Health Facility. This is located in a mountainous area, which is in Region 8 of Guyana, and it was retrofitted to become safer and greener, meaning that it's more resilient to natural disasters and climate change, where they would have implemented green upgrades, which provide efficient cooling, improve rainwater harvesting system, LED lighting internally, and solar lighting externally. So to answer the latter part of your question, in terms of how climate smart technology can be more accessible and affordable for underprivileged and remote area, this is making it more resilient, as in terms of continuous supply of medical services, electricity, and water supply. And this, just to be clear, this is very much affordable and it's very cheap to implement. Thank you.
Awesome response. Thank you so much, Anna, for that. Should anyone, as a panelist, wants to contribute, you can please just do well to also unmute and speak to that. Conversation is still on the affordability of this climate smart technology to even those in privilege. How can climate smart improve? Meanwhile, while we still look out for the panelists who wants to respond to that, as many of us that are listening in, please do well to, if you have any questions, do well to drop it in the chat, or you drop it in the question and answer section. We have a Q&A section there. You could use that to drop your questions, and definitely would be answered. So maybe I should just call Dr. Hospedales wants to contribute to that question. How would climate smart technology help to improve affordability, particularly in privileged regions?
Thanks for that, Lawrence. I think I'd like to, because I'm one of the older folks here, I'd like to just have a look at technology. It's not only computers and fancy machines, you know. when I worked on the Caribbean disaster response team with Pan American Health, I saw hospitals and health centers that would be blown away by powerful storms. So climate smart technology in that instance involves building your facility in such and designing it in such a way that that doesn't happen. So for small island states all over the world, the Caribbean, the Pacific, the Indian Ocean, these sorts of old technologies are important. Some of you may remember the story of the three little pigs, where a mother pig has three piglets, and she's a poor mother, and she sends them out. And one pig meets a person who has a bundle of straw, and he takes the straw to build this house, and the bad wolf comes along and blows that house down. And another one builds a house out of sticks, and the bad wolf comes and blows the house down. And the third pig used appropriate technology. He built his house out of bricks, and the wolf could not blow it down, so he couldn't eat him up. Now that's a simple example, but designing a health facility with a hipped roof so the wind can't lift it off, tying the roof to the foundations, but I'm getting into Judith's turf. She's the engineer. You know, that's an example. Another is green technology, which Susana commented on, using renewable energy, for example. Another would be in the medical domain of what you prescribe. So I have asthma, and this is an asthma inhaler. And when we have bad Sahara dust days, which are increasing in frequency in this part of the world because of the desertification and the droughts in West Africa, then we're getting more and more topsoil blown over here. But this little device, if it doesn't have the right propellants in it, it's like driving a couple of 100 miles in a car in terms of carbon footprint. So green technology would see that you replace this with something that's just as medically effective, but doesn't have that carbon footprint. So that's another example. Water reuse and rainwater harvesting would be another example. So those are some of the examples, even before we get to the more high-tech stuff like digital and computers and mobile phones. We have to remember that there's a lot of older technology and design that's very appropriate for facing climate change and adapting to climate change and mitigating climate change.
Thank you so much, Dr. Hospedales, for that. And the next question I would just ask still would dwell on some of the things you just talked about. I would just highlight particularly what we call the digital divide when it comes to people accessing health care services, yeah, because in some regions we know that there's always problem of inequity, and digital divide is always a challenge because not everybody is able to access digital subjects. Now, in terms of implementing climate smart technology, part of which would also be digitizing, using digital technology. Yeah, will this have any impact on the digital divide? And if it does, how can we actually, through implementing this climate smart technology, how are we able to now reduce or bridge that divide?
That's a great question, Lawrence. Thank you. And the digital divide or digital exclusion refers to some people not benefiting as much or actually losing access because of the use of digital technologies and digital health. And the COVID pandemic is a good example. I was involved in a study here last year in Trinidad and Tobago, which is where I'm based, on resilience of the healthcare system. And we saw that COVID prompted a lot of use of digital technology, data sharing, more telemedicine consultations. And I think the lessons from that and the lessons from elsewhere have to do with some people don't even have connectivity. Some people may be of low literacy, and to be able to use this technology, they need to improve in that regard. Some people, even though older adults, for example, people with disabilities, if they can't see too well, poorer people may not be able to access. And so I think youth can actually play a great role. I mean, my grandchildren and my daughter are the ones who help me a lot with some of the fancy technology. But to get to the direct question, how to reduce this, I think designing of digital health services with patients and clients in mind is important, and involving them in the design is important. And I want to give an example from the island of Tobago, where they've tried to foresee this. So in community centers and in the health center, there is a form that you can fill in by patients and their families if somebody has a disability or if they're a person with diabetes on insulin. This information is collected by the Emergency Management Authority and shared in a database with the Ministry of Health, so that when disaster strikes, they know in advance who is most vulnerable, who will need to be medevaced, who might need to have special provision for insulin or something like that. I think the other thing to do is to look at see how industry partnerships can be helpful. And for example, the TM Forum, which is the biggest platform of mobile providers and their suppliers in the world, they're based in Ireland. They have been one of the pioneers in promoting the use of green asthma inhalers and supporting their use. So that's an example of where industry can be helpful in bridging this digital divide. And don't assume that health professionals know how to use it either. So I think health professionals also need training in how you use some of these new digital tools. I think offering choice is important. So you can ask a patient or a client, you know, are they comfortable with the phone? Can they handle a Zoom call? Or do they want to still be able to see somebody in person? These are some of the things that could be useful in how to minimize that digital divide. And then the last thing in choice is to give patients control over access. So for example, when populations are displaced or forced to migrate because of extreme weather, a bad hurricane or bad floods, it'd be very useful to have cloud-based medical records for patient care continuity. And then you give the patient access to that. So in situations of refugee camps, in situations of forced migration, that's a way of helping to bridge that divide, but also giving the patients control. So I've said quite a bit there. I hope that's helpful, Lawrence, in thinking of how do you recognize and address and minimize this digital divide risk that we face. Thank you.
Thank you so much for that. That was really, really insightful. And I want to believe that the participants are actually learning a lot, because one thing that stands out for me is the part where we need to emphasize training of even the health professionals, because we shouldn't even assume that they're experts themselves in using these things, and let alone having to train people who also receive these health services. I think that's really very important. So as we move along, I would also want to ask again that should participants have questions, you can do well to drop them in the chat or drop them in the Q&A box. So I'll move forward asking another question. And this time around, okay, I think I'll just throw this question at Dr. Judith Harvey. And the question actually focuses on ethical implication now, because people are often always very resistant to change. It's in nature of humans to be quite resistant to change, and seeing that we are moving from conventional form of health delivery towards having to implement climate smart technology. Do you think, or are there any ethical implications that people should be aware of? And for people even having doubts as to whether or not shift is necessary and how safe it is and all of those conversations, what would you actually comment with response to the ethical implications?
Thank you, Lawrence. And the ethical implications of climate smart technology is a wide topic. I'm going to try to break it down as well as to be brief, giving some issues and a flavor for it. Firstly, thanks to Susana for introducing the concept of climate smart technology in the context of a Caribbean example and a real health facility in Guyana, so that participants know climate smart technology is safe and green health facilities. And these safe and green health facilities, or smart hospitals, as Dr. Hospedales noted, can use older technology like bricks to withstand strong winds. But There are ethical questions associated with the carbon footprint of building a new facility and expanding an existing facility. So those bricks, although very desirable, are known to be made often of concrete, which has a very high carbon footprint. So it is an issue here of balancing the contribution to global warming from the concrete manufacture, or sacrificing the space, the additional space, or the need for this new facility, minimizing the space that is available. So this is one ethical debate which I am leaving with the participants. Another ethical debate I will leave with the participants is to do with the fact that these health facilities that have been renovated have very reliable sources of water and electricity. And these sources of water and electricity continue to function and are readily accessible after major disasters such as floods. But the people in the communities, their homes and their workplaces often do not have electricity and do not have water. And they come to the hospital or the health center actually to obtain supplies that they can use at home, to get a bucket of water, to charge their cell phone. And again, there is a balance needed between the needs for provision of healthcare at the hospital or at the health center, and the sharing of these resources with the general community for use at home. We have had examples, real examples in the Caribbean after troughs and floods, where the residents in a community came to the health facility after a hurricane to obtain access to electricity and water. So this is another ethical consideration that again I throw back to parties in ethics. Another ethical capital cost and the financing of renovations that improve the safety and the greenness of the health facilities. If the health facility is government owned and the funding is from a donor such as UK government, it is less painful to the users than if, for instance, a private practice tries to green the facility and pass on the cost of that greening to the consumer. So again, who benefits and how can these benefits be realized best for community and users? And the savings in lives, not only in utility bills, but in people who can be served after a disaster or treated, injuries treated. These savings in lives cannot be quantified in money, but they are a real benefit. So again, that is an ethical question. How much is a life worth? How much is a life saved worth? And finally, to consider the maintenance over the long term and the cost and the accessibility to the technology for low-income countries, again raises ethical questions. Is it better to have a sand filter? Often this is the technology used in Guyana, very effective, but much simpler than a cartridge filter made of plastic and imported and thrown away when it is clogged. So I've given participants many ethical issues to consider, and I have illustrated that there are ethical questions, but no easy answers. Thank you.
Wow, wonderful, wonderful. Dr. Judith Harvey, interesting questions there. They're quite insightful and thought-provoking in terms of considering the ethics, comparing business as usual to when we have climate smart technology being implemented. And that actually brings me to the conversation on environmental impact also being an issue of ethics, yeah, and how much environmental impact is implementing climate smart technology going to have as compared to business as usual? And like we want to believe unarguably that since it is climate smart technology, it definitely has lesser impact compared to business as usual. And one part to it is actually conversation around how implementing this climate smart technology can lead to the reduction of waste. And I would maybe want you to also talk about that. Do you think when implementing climate smart technology, because of course it is well established that the healthcare system is actually very much accountable for the generation of a whole lot of waste. Yeah. Now, considering this, do you think implementing climate smart technologies can actually help reduce the amount of waste generated? And if so, could you actually share with us and with the participants here examples of how those things have been implemented? Maybe, I think one instance Dr. Hospedales shared actually is the inhaler is using, which happens to be green. And he could also speak further with regards to that, but I'll just start from Dr. Harvey.
So I'll begin, and the waste from a health facility is in different forms. There is liquid waste, solid waste, and the gaseous emissions. And controlling waste is a challenge, again, with no easy answers. The liquid waste control appears to be fairly well developed in terms of the technologies from the Caribbean experience and perspective for treatment of the wastewater and the water that is coming from the facility, even to the extent of recycling, reuse, and distribution, safe distribution to the environment. The solid waste component is a bit more challenging. There's separation between more dangerous or infectious waste and sharps and more normal, similar to household waste. But one thing encouraged by the PAHO tool, the green checklist, is composting. It's not a high technology method, but it certainly minimizes the amount of waste that would go to landfill and creates byproducts such as fertilizer that can be used for another purpose. And I think the control of the gaseous waste is least well established, certainly in our health facilities. And I want to add that the medical personnel among us, including Dr. Hospedales, and later, in a later panel, we will hear from Dr. Campbell, will be able to illustrate the sources of waste from the healthcare treatment process and the ways that that can be dealt with. But I know with a simple example like reuse of cutlery, which would prevent having so many disposable lunch containers. That is one of the items, again, in our green checklist. That has ethical implications because not everyone wants to be in a position of reusing, even though an item may be sterilized and cleaned in a proper manner. So I will hand over here to other members.
Thank you so much, Dr. Harvey. So still on conversation, we know that currently there are existing alternatives to some of the instruments, equipment that are being used, and other apparatus used in the hospitals that I would like Dr. Hospedales to share with us, and how that these new equipment, as it were, reduce waste generation in healthcare.
Thanks again, Lawrence. Hi again, everyone. Well, Judith started off by outlining different kinds of waste and the challenges of dealing with some of them. I think the medical profession, and I'll speak for myself, you know, in the way you're trained to make a diagnosis, prescribe good treatment. And honestly, you hardly think about the waste or the environmental impact of what you're doing. Your focus is on the patient and on delivering good quality care. And so it's only with the more recent years, the environmental awakening that's happening, and organizations like Healthcare Without Harm, Nurses for the Environment, are paying attention to the environmental impact of waste. We heard from a colleague surgeon in Canada recently that they got awoken to this and they started to examine their own practices. The amount of plastic waste that is generated by the operating theater is phenomenal, because every patient gets a big plastic bag and you put all the things inside of there and that has to be disposed of. So one step in the process, which is not a technological step, is really stepping back and asking ourselves in the healthcare professions, do we really need all these things that we're using, plastic and bags and so on? During the COVID epidemic, I met a nurse who was going through 100 pairs of gloves in a day. 100 pairs of gloves. But you don't need that many pairs of gloves to deliver safe healthcare. Among the technologies that I recently heard about that sound interesting are solar-powered pyrolysis to burn without emission solid waste, which could then be disposed of more safely and without generating a lot of greenhouse gases. So those are some of the things to think about. I think, as I said, one, education of health professionals in their training about the importance, the environmental impact of what they do and the carbon footprint. And it is not enough to just think of delivering high quality care without thinking, as someone said in the earlier session, about the impact on the environment. That is a waking up job that my organization is involved in training health professionals across the Caribbean. Last year we reached several hundred, and next year we're planning a much bigger program, reaching the nurses. There are more nurses than doctors. They're closer to the community. They're trusted. So if we get them more sensitized to this, we can make some dent in this problem of waste from health facilities. And the medical leaders, the medical students, the faculty in the university, they actually all need sensitization to this issue, and to see hold up a mirror and examine yourself. Why are you doing this? You've always done it that way, but why? And challenging themselves about, is there evidence for this practice of using so much plastic, for example? So those are some answers to you, Lawrence.
Awesome. Thank you so much, Dr. Hospedales. And to relate to what Dr. Judith Harvey had said earlier on, you see, as a common man, permit me to use that word, you need a lot of efforts to really quite help them understand that you don't exactly need to have new tools or new devices to treat them, because these things can be sterilized and at the same time made safe and clean to still use them. So I think that's where the role of sensitization comes in. That's the role of education, where patients themselves have to be aware that these practices are safe and at the same time have environmental benefits. And I think those are really insightful things that we would be taken out of here to also help the public be aware of. Talking about all of this, I think I'll just try to focus more now on youth engagement, because yes, I believe that there are a number of young persons on this call, and we're having conversations around climate smart technology and how that this can actually be useful in providing healthcare service. And then the question that I want to come to mind is, in all of those conversations, what role do you think youth would actually play, even in the design, the development, and the implementation of some of this climate smart technology? The youth, like we all believe, have crucial roles to play when it comes to addressing climate change. Now, in this context, what roles can youth actually play in both developing and implementing? I think I will pose this question to one of the younger persons on this call. Jonathan, what do you have to say with regards to that?
Okay, hi everybody. I just want to first thank Dr. Harvey, Dr. Hospedales, and Susana for their insightful answers in the previous questions. And I just want to say the youth are, frankly, the future workforce of the world. So they need to ensure that they're first aware of the issues surrounding why climate smart technology needs to be implemented. There's a need for these skills skills to be developed, and like they need to be taught these skills. And I think this falls this falls in the hands of adults and governing bodies, and also the climate smart technology implementation needs to include the youth so that they can be a part of the process and learn, so that in the future, when they are the workforce of the world, that the climate smart technology can advance and continue to evolve. Additionally, I think the youth tend to undersell the power of their collective voice. And I really think that the youth together, their voices can have a meaningful change around the world. So youth needs to band together, and as they're able to influence and move and inspire the change that needs to occur. So I would encourage youth to take part in using their collective voice in things such as activism in the form of clubs, social media, public speaking, and even simply calling out harmful practices they can see around them in their communities. So yeah, that's what I think, that those are ways that I think the youth can really impact and make a change.
Yeah, thank you so much, Jonathan, for that. And you said something very insightful there. You talked about the fact that the youths are able to call out. Yeah, one thing that we are good at as young people is we identify something we think is not right, and then we just want to call it out. We want to hold people accountable. And I think that's very necessary, even in this conversation. And I think the youth can also lead policy changes, policies that actually encourage the adoption of some of this climate smart technology, even in healthcare delivery. And then we can, of course, use campaigns to also make our voices heard and try to negotiate policies, also inform. Once we are talking about the health professionals themselves, we're also trying to, ourselves as young persons, also inform who at the end of the day end up being patients in this hospital, to also be able to embrace this technology. And I would also speak to what I'm trying to bring a switch up between what you've said and what Dr. Hospedales said earlier on. One thing that is necessary, like you also highlighted, Jonathan, is the fact that the youth has to be involved in the design, in the whole implementation phase. The youth has to be brought on board, as it were, to conceptualize this, to design it, to develop it, and to implement it. And that's what Dr. Hospedales said. Now, beyond the youth, all stakeholders have to be brought together, especially if we want it to be affordable, if we want it to be accessible, then we need to integrate the opinion, the concerns, and the peculiarities of all stakeholders to be able to achieve that. And I think we're all trying to see the connection between all of this conversation. I think it's very insightful. And I will just proceed. I can see a question in the chat, and I would ask now openly. I don't know who would want to pick it up from here. So the first one I would say is, so we have a question on, I'll just read it out. It's written: how can we encourage the use of good quality pipe water, that's talking about potable water, rather than the environmentally destructive bottled water, which happens to be very common really in hospitals, where you see bottled water as maybe different parts of the world, but it's quite common. They would rather give you bottled water, which is presumed to be safe, but of course environmentally destructive, than asking you to use potable water. So Dr. Harvey, what would you say with regards to this? How do we then encourage the use of good quality pipe-borne water?
Thank you for directing the question, Lawrence. And certainly from the perspective of engineering, it is to do with the level of water treatment and water supply systems, not only at a health facility, but in the community. And we have a section coming up in the next panel to do with water. So this will be just a flavor. And for one thing, there is the importance of harvesting rainwater. So there's no shortage often in many countries. Now, I cannot say in all because there are droughts, there are deserts and so on, but there is no shortage of the supply, but there may be a lack of good treatment. There may be leaking pipe work, and there may be sources of contamination entering the pipe-borne water system. So the monitoring and the maintenance of the water supply and treatment is what would give that confidence in the water, and the provision of the reserve supply for disaster situations would then respond to the partial answer, which I welcome, which came through the chat also, that people don't have that confidence in the water that they can drink from the pipe, and this is why they resort to the bottled water. So I don't want to take too much from the next section, but to just give that flavor as a response. Thank you.
All right, thank you so much. Thank you so much, Dr. Harvey, for that. Very insightful. I think I'll just read something that also speaks to what Jonathan had said earlier, and this is from Terry. I'll just read this and we'll wrap up in the next 1 to 2 minutes. Terry says here that young leaders have to assert themselves to protect their future. Youth can help create the urgent need, the outrage, or sense of injustice that can actually break through the inertial habits and really get ordinary people to pay attention, to motivate them at risk doing something new and uncertain, particularly when you know that this new thing and this seemingly uncertain thing has a lot more long-term benefits compared to doing business as usual. I think it's been a wonderful conversation so far. And lastly, just as take home, I would do this, say 30 seconds or 1 minute, 30 seconds would be safer. What would be your take home for? What would you rather that we as viewers, as listeners, as participants take home from this discussion today? And I'll start from Susana. What would you say to the participants with regards to the conversations we've been having so far? Take home.
Thank you, Lawrence, for asking. So my one takeaway is with youths, we need to be more active. And as Dr. James would have stated, everyone, despite our speciality, whether you're a nurse, whether you're a pharmacist, whether you're an environmentalist, youths in a whole need to take charge and be more active in the form of implementing, whether it be for our sector, which we just discussed on smart technologies, and also climate action in a whole. So that is my takeaway.
Yeah, thank you so much. Can we hear Dr. Hospedales, just 30 seconds? A final note.
Sorry, trying to get the unmute button. Are you asking me for a final word?
Yes,
well,
exactly.
I think climate smart health technology, health systems is a broad concept, and I hope the young people and others on this call have a better appreciation of the scope of climate smart, from how you build your facility, how you maintain it, use of renewable energy, reducing medical waste, use of smarter digital technologies while minimizing the divide. That's the scope of it. And maybe some years ahead, we'll come up with some other dimension. But we hope that everyone would, being more sensitive to this, would actually advocate now for climate resilient, climate smart health systems as an essential component of national development.
Thank you so much. Dr. Harvey, can we just have you?
Yes, I think that my takeaway would be that even the youth today cannot eat, drink, and be merry without thinking that there is another generation to come after them, and therefore should be climate aware and climate smart in their own contexts. And to think when you look at a building or facility that you are not only seeing what is on the surface, there are hidden pipes and hidden electrical circuits and so much more that contributes to the greenhouse question. Thank you.
Thank you so much. And lastly, we have Jonathan.
Hi, sorry, technical issues. Yeah, my takeaway for this discussion was that there's a lot of the ethical implications of integrating climate smart technologies are very it's a very hard question to ask, and it brings about a lot of thought. And I think that there's a lot of discussions that need to be had in the regard of implementing these technologies. I think that the youth, and I think that the youth really needs to be involved in these conversations as because as they grow up, they are the workforce of the world, right? So obviously these implementing these climate smart technologies needs to involve the youth more, and also the youth need to really use their collective voice, and because it's really powerful. They need to really continue to use their collective voices and really try to be a part of this evolution of healthcare.
Thank you so much, Jonathan. Thank you so much to all of our panelists. I must tell you, I, for one, have had reasons to find this session very insightful. And moving forward, we all as listeners, we all as panelists, as co-moderators and everyone on the call, it's important for us to take those lessons back home and see how that in all things we do, we are reminded of the future and we're reminded of the roles we have to play to promote a climate resilient world. Thank you so much once again for joining in this session. I will now hand over to Ashley to continue with the conversations moving forward. And please stay tuned and listening to the next sessions that will be coming up on board. Thank you very much all, and goodbye.
Thank you, Lawrence. Thank you, panelists. I mean, oh my God, what have we just witnessed? Together, it has been highlighted that we are forging a path towards healthcare systems that not only address the needs of our communities, but also safeguards our planet.